Today we're going to talk about the features and benefits of one of the newest and most innovative biologic products offered by Arthrex, called JumpStart with Advanced Microcurrent Technology. JumpStart is the only wireless microcurrent generating dressing on the marketplace. It contains elemental zinc and elemental silver to create microcell batteries which conduct an electrical charge when in the presence of a conductive medium such as wound exudate, saline, water, or hydrogel. These microcell batteries will stay active up to 7 days as long as they're exposed to that conductive medium. What's really unique about this particular product, it does not require an external power source at all, such as wires or batteries to create that electrical charge. Now, the body itself normally transmits electrical currents as it has transepithelialization potential. However, when an incision or wound occurs, there is a change in the electrical potential. The body now creates new electrical guidance to signal cell migration to the wound site. Now, this is where JumpStart provides one of its most important benefits. Once activated, JumpStart creates a microcurrent which provides antimicrobial efficacy against a host of pathogens. In this zone of inhibition study, a poloxamer hydrogel was loaded onto a plate and exposed to clinical wound isolates. These isolates were grouped into a placebo sample, a JumpStart sample, and a silver sample. As you can see from the results of the placebo sample was overtaken completely by the bacteria. JumpStart was effective in keeping a clear zone of inhibition from the bacteria, and silver was somewhat effective, but the bacteria are clearly present within the sample. JumpStart has also shown to provide biofilm efficacy. In a study by Banerjee, they exposed JumpStart and a silver dressing to a strain of Pseudomonas. After 24 hours, they performed a live dead staining to see how much of the pathogen remained. As you can see, JumpStart was very effective in killing this pathogen compared to the silver-based dressing. This illustration provides an example how the microcell batteries work in creating a microcurrent. Once they're activated in a conductive medium, they create this electrical charge. The gram-positive and gram-negative pathogens are attracted to the microcells, and once exposed to the microcurrents, the pathogen is destroyed. Now, here is a list of antibiotic-resistant pathogens that JumpStart has proven effective against. As you can see, JumpStart is effective against Pseudomonas, a host of staph, vancomycin-resistant bugs. Here is a view of pathogens that JumpStart is effective against to provide antimicrobial efficacy. JumpStart has proven that it's effective against E. coli, Pseudomonas, staph, and P. acnes. And in this slide, we see that JumpStart is effective against biofilms. It showed efficacy against a wide variety of mono and multi-species biofilms. In this study, JumpStart was investigated to see how it affected keratinocyte migration. Keratinocytes were placed into petri dishes, and a scratch test was performed to see how the cells reacted when exposed to silver and to JumpStart. The cells were analyzed at time points 0, 6 hours, and 9 hours. As you can see, JumpStart was more effective against the silver and placebo in terms of attracting the keratinocytes to close that particular scratch site. A study reviewing the efficacy and healing potential of JumpStart was reviewed in terms of the split-thickness skin grafts. 13 patients were enrolled, and a burn surgeon with 30 years of experience was blinded to grade the epithelialization of the patients. Half the wounds were treated with a transparent dressing, and half the wounds were treated with JumpStart. The surgeon rated the JumpStart group as superior to the standard of care group, with a 71.8% epithelialization versus 46.9% with the standard of care group, showing about a 35% faster healing rate. The patients also had the opportunity to grade their wounds, and they rated JumpStart superior in terms of scar color, stiffness, thickness, and overall quality. A rehab facility reviewed the economics of treating 13 patients with multiple comorbidities for acute and chronic wounds. They reported that JumpStart patients needed fewer bandage changes and that their wounds healed faster, resulting in significant cost savings to the facility. Now, JumpStart can be used in a number of different applications, anywhere from acute to chronic wounds, such as superficial wounds, first and second degree burns, pressure ulcers, surgical site incisions, donor sites, full thickness wounds, venous insufficiency ulcers, and diabetic ulcers. Now, JumpStart comes in a single contact layer dressing. This is a polyester substrate containing elemental silver and zinc components. It's also fenestrated to allow for the passage of wound exudate and fluids. And it's a very ultra-thin, lightweight design that contours to the patient. What's unique is that you can actually cut through the bandage itself and not worry about breaking the electrical current. The product itself comes in a number of different sizes to meet the needs of your potential case. We also offer it in a composite dressing. This comes not only with the single contact layer, but it also has a foam layer behind it and then an adhesive layer that is waterproof that can be used for patients that want to shower. To summarize the features and benefits of JumpStart, it's the only wireless microcurrent generating antimicrobial dressing on the market. It contains novel microcell batteries that are embedded in the bandage. It has biofilm disruption and prevention, has demonstrated antimicrobial effectiveness, has demonstrated ability of the microcurrents to enhance cellular migration. It may assist with cosmesis. We have multiple sizes available, which makes the product very cost effective. In this demonstration, we will show you how the JumpStart dressing does not create a current when it is not activated via a conductive medium. So here we take the negatively charged probe and we place it onto the zinc, and then we take the positively charged probe and we place it onto the silver. As we can see from the voltmeter, it registers no current charge. However, as soon as we place a conductive medium, such as saline, wound exudate, or hydrogel, onto the device, it becomes activated. And now, as we demonstrate again, we will make sure that the voltmeter is at 0. We will take the negative probe and place it onto the zinc, and then we will take the positive probe and place it onto the silver, and watch as the charge now shows 0.8 volts, now proving that a current is being generated through the JumpStart dressing. To learn more about the benefits and to review the scientific information about JumpStart, please log on to the arthrex.com website, click on the orthobiologics section, and find the JumpStart link.